You are doing everything right. You are diligent about your health. You supplement with calcium and vitamin D3 every single day. Your doctor likely recommended it. You do it to keep your bones strong, to prevent a fall, to avoid the devastating fractures that steal independence. But what if I told you that the very calcium pill you are taking to save your bones could be hardening your arteries? This is not speculation. This is not fear-mongering. This is a well-documented scientific reality known as the calcium paradox. The big question is this: how does the calcium you ingest know where to go? In this video, I am going to explain exactly why relying only on calcium and D3 is a dangerous mistake after the age of 60. And I will introduce the one forgotten nutrient that acts as the traffic cop, ensuring that calcium goes into your bones and stays out of your arteries. This is the nutrient linked in major studies to a staggering reduction in fracture risk, in some cases by as much as 77%. Decoding the calcium paradox. When you take a calcium supplement and vitamin D3 helps you absorb it, that calcium enters your bloodstream. But here is the critical problem. Calcium does not have a GPS. It does not automatically know its destination. Your body essentially has two places to put that calcium. First, your hard tissues, which are your bones and teeth. This is where we want it to go. Second, your soft tissues. This means your arteries, your heart valves, your kidneys, and your joints. This is where we absolutely do not want it. When calcium accumulates in your soft tissues, it causes calcification. Arterial calcification, or the hardening of your arteries, is one of the single biggest predictors of cardiovascular disease, heart attacks, strokes, and high blood pressure. This is the paradox. In your effort to prevent bone fractures, you may be unknowingly increasing your risk of a heart attack. Your bones are starving for calcium while your arteries are turning to stone. So how does your body control this? It uses two critical protein switches. The first switch is for your bones. It's a protein called osteocalcin. Think of osteocalcin as the construction worker inside your bone. Its job is to pull calcium out of the bloodstream and bind it, or glue it, onto your bone matrix. This is what builds bone density and strength. But here's the catch. Osteocalcin must be activated to do its job. The second switch is for your blood vessels. It's a protein called Matrix Gla Protein, or MGP. Think of MGP as the security guard for your arteries. It is the most powerful inhibitor of soft tissue calcification known to science. Its entire job is to patrol your blood vessels and remove any rogue calcium deposits. But just like osteocalcin, MGP must also be activated to work. You have a builder for your bones and a guard for your arteries, both waiting for instructions. So, what is the missing link? What is the key that turns both of these proteins on? The answer is vitamin K2, the unignorable evidence. This is the core value that 99% of people, and frankly, many doctors, have missed. Vitamin K2 is the traffic cop for calcium. Here's how it works. Vitamin K2 activates osteocalcin, telling the builder to start building bone. Vitamin K2 also activates Matrix Gla Protein, telling the guard to start cleaning your arteries. Without K2, you are swallowing calcium, but it's just floating aimlessly through your body, ending up in the wrong places. It's like loading a cannon, the calcium, but having no one to aim it or fire it. This is not a theory. We have powerful human data. The most famous is the Rotterdam Study, published in the Journal of Nutrition. This massive study followed thousands of elderly adults in the Netherlands for over 10 years. The results were stunning. The participants who consumed the highest levels of vitamin K2 in their diet had a 52% reduction in severe aortic calcification. And even more staggering, they had a 57% reduction in mortality from coronary heart disease. The evidence for bone health is just as powerful. This is perhaps the most astonishing part. A major meta-analysis published in the Archives of Internal Medicine looked at multiple Japanese studies. It found that supplementing with vitamin K2 was associated with a 60% reduction in vertebral, spinal fractures, a 77% reduction in hip fractures, and an 81% reduction in all non-vertebral fractures. These numbers are not trivial. A 77% reduction in hip fractures is life-changing. This data clearly shows that vitamin K2 is essential for both building strong bones and protecting your heart. Now you might be thinking, but I eat spinach. I eat kale. I get plenty of vitamin K. This is the most common and dangerous confusion. You are thinking of vitamin K1. Vitamin K1, or phylloquinone, is found in leafy green vegetables. Its primary job in the body is blood clotting. Your liver uses it to make sure you stop bleeding when you get a cut. Vitamin K2, or the menaquinone, is different. It is found in animal products and fermented foods. Its primary job is calcium metabolism, directing that calcium. While your body can convert a tiny amount of K1 to K2, it is wildly inefficient. Vitamin K1 cannot effectively do the job of vitamin K2. Your action plan: we have a major problem in our modern Western diet. It is profoundly deficient in vitamin K2. We simply do not eat the foods that contain it anymore, like fermented foods or organ meats from grass-fed animals. It is highly likely that you are deficient in vitamin K2 right now and do not even know it. If you want to fix this, you first need to know that not all K2 is the same. There are two main forms you will see: MK4 and MK7. MK4 is the short-acting form. You find it in animal products like grass-fed butter, egg yolks, and liver. It's effective, but it only stays in your blood for a few hours. MK7 is the long-acting form. This is the one found in fermented foods. The single richest source on Earth is a Japanese food called natto, which is fermented soybeans. It's also found in certain hard cheeses, like Gouda and Brie. The benefit of MK7 is that it stays in your body for over 72 hours, allowing it to work around the clock, protecting your bones and arteries. You should always try to get nutrients from food first. If you can eat natto, it is by far the best source. But for most people in the US and Canada, the taste is very difficult to acquire. You can get smaller amounts from high-quality cheese, but it is very difficult to get a protective dose from the average Western diet. This is why many experts now look to supplementation. Most of the key studies on bone and heart health use a dose of around 180 micrograms. That's micrograms, not milligrams, of vitamin K2 as MK7 per day. Now, I must give you the single most important safety warning of this entire video. If you are taking a blood-thinning medication, specifically warfarin, also known as Coumadin, you must not supplement with vitamin K2 without strict medical supervision. Vitamin K, both K1 and K2, works directly against the action of warfarin and can increase your risk of a blood clot. This is a non-negotiable safety rule. You must speak with your doctor before considering a K2 supplement so they can adjust your medication if necessary. Conclusion and next steps. So, let's bring this all together. Taking calcium after 60 without vitamin K2 is like having construction materials, calcium delivered to a work site, but with no workers, Osteocalcin, to build the house, and no security, MGP, to stop thieves from piling that material in the street, your arteries. Vitamin K2 is the essential traffic cop that has been missing from the conversation. It is scientifically shown to help reduce arterial calcification and dramatically reduce fracture risk. The solution is not to stop calcium, but to supplement smarter by ensuring the director K2 is present. Now that you understand why K2 is the critical missing link for your calcium, it's vital to know how to pair it correctly with the vitamin D you're likely already taking. In our very next video, we'll break down the exact ratios of D3 and K2 you need to discuss with your doctor to ensure you're getting the benefits without the risks. Click the video on your screen to watch that now. Before you go, I want to ask you this. After learning this, do you feel that the mainstream focus on just calcium for bone health has been incomplete or even misplaced? Share your thoughts on what other common health knowledge you've started to question. Please leave your comments below. I read them all. This content is for informational purposes only and does not constitute medical advice. Please consult with your physician before making any changes to your diet or supplement routine.